my morning break. Oh, don't you know, you keep me up on everything I need to know.
Well, high blood pressure, or hypertension, is often referred to as the silent killer because it doesn't have noticeable symptoms. And in Hypertension Education Month, this medical community finds itself reminding people of the importance of monitoring your blood pressure, but also of doing things they probably already know they should be doing. While high blood pressure can be hereditary, it is pretty commonly known that a poor diet and a sedentary lifestyle are the biggest factors in developing hypertension. We have our blood pressure taken almost every visit to a doctor's office. Your doctor will often stress healthy eating, lots of fruits and vegetables, limiting red meat, and exercising regularly. But during this Education Month in May, physicians are often advising patients about the hidden contributors to the silent killer of hypertension.
So the alarming things that we think about, what I try to talk to my patients about mainly is, salt intake, right? So salt intake, and salt's everywhere. First time that I talk to patients, the first thing says, well, I don't really add much salt. I'm great, but that's not really the issue. The main issue is that's already in the foods, processed foods, going out to eat, and canned products. Those are the real big ones, and a lot of that's in the processed foods. So it's diet, it's exercise. And really the number one cause is non-adherence. You know what the number two cause is? Non-adherence. Do you want to know what the number three cause is? Non-adherence. So not taking your medicines, not being, doing what's being asked, again, that's what gets you. The medicines can do it. Diet, exercise, again, is all part of that adherence price.
Well, just about half of the adults in the United States have high blood pressure, with men slightly more likely to develop it than women. That's such a good tip to point out about that hidden salt, because it's one thing that I don't ever look for in foods. You might look for calories, you might look for carbs, or sugars, or whatever you're trying to restrict. I never think to look for salt.
I don't either, and now it's something else to add to my list. I actually just started looking at the back of everything, and I'm kind of like blown away now. And now I have to add sodium to the list of things. Because he's right. In my head, I'm like, I don't put salt on my food, really.
Right. But it's in everything.
Yeah.
I cook with a lot of salt. I do say that. But I also have never had an issue with high blood pressure. So not that I'm going to completely ignore it, but I will start listening to what he has to say.
Yeah, we have to. You heard him. Got to start listening.